Good evening and welcome to the Silicon Valley Entrepreneur. I'm Chris Gill, CEO of SVForum, the largest and fastest growing organization for inspiring and supporting entrepreneurs and technologists in Silicon Valley. Tonight I'm delighted to have with us two of the people who presented at our recent launch Silicon Valley event, and their presentations and companies were voted to be the most likely to succeed in their sessions. So I'm delighted to have Frank Ball of Evena Medical and Derek Bell of
KlickEx.
KlickEx. Jeez, the brain goes after a while. We've been talking away here for several minutes and the brain just misfired on that. So thank you both for coming along. Great to have you here. And if I can start with you, Frank, could you tell us a little bit about what Evena Medical does to set the scene for us?
Well, the short answer is Evena Medical is a health IT risk mitigation platform. In English, that means that we help reduce errors and mistakes made in medical situations, especially around IV therapy. We manage starting IVs as a sourcing and tracking and documenting the procedures.
And how did you come up with this? Why was this seen as a problem? Why did you think you had to come up with a better way of doing it than the way that's done now?
Well, it's a huge problem, but we had kind of a unique start because I wasn't there in the beginning. It was actually developed by a nurse working right down the road here at Valley Medical Center, and he saw the problem, understood the problem, and had the image, the vision for how he could cure it using near-infrared light to image these veins under the skin. And in turn, he got a number of other nurses involved. They put their money together, got some patents going. A few doctors got involved, put more money in, and it kind of slowly started building momentum. Ultimately, they incorporated, they brought in some additional people to help run the company, and in 2010, the chairman, the company was struggling, shall we say, and the chairman contacted me. He and I had known each other for a couple of years, and asked. He knew that I had done some turnaround work, and asked if we would be, if I and my team would be willing to come on board to help turn the company around.
And what's a typical need for this type of product? It is a product or a service? What's the?
It's a device, a product, and a service.
Okay.
Because a big component of it is kind of like a SaaS model. There's a recurring increment that they pay for each procedure, which makes the entry cost very nominal and makes it very lucrative with a lot of recurring capital, yet doesn't tie up the hospital's capital.
Okay. And what's a typical use for it?
The most common use is starting an IV. You know, if you look at your arm, it's difficult to see your veins, and ironically, the more you need an IV, the more difficult it is to see your veins because you're in shock and bled out, dehydrated, whatever. But also, after the IV is started, a big problem is infiltration extravasation, which is fancy talk for the IV leaks. And it can't be seen. It's under the skin. It's kind of like you have a leaky pipe in your walls. You don't know it until it's leaked out and done a lot of damage. Likewise, when the IV leaks, you don't know it until it's done a lot of damage. But we can see through the skin and see that leakage in advance and then create a documentation record each time we check by taking a picture to make sure that it was in fact patent. Oops, it leaked, got caught, was dealt with.
Okay, brilliant thing. And what's the size of the market? I mean, how often do IVs get screwed up? How often do they miss the veins? You
know, it depends on the age and health of the individual, even the type of needle that's used. But it's a very high number. Typically, a number anywhere from 18 to 35% of IVs will leak or extravasate at some level during the duration of their dwell time.
Wow.
It's a big problem. But if you've ever gone in and done a blood draw and you've come out and you've had a big bruise, the bruise was blood. Blood leaked under your skin. Well, if it was just blood, it's generally not a real big problem. But if there was also any kind of chemicals being added, such as infusion, then that leaking out can be a problem. But if you had blood, then you were a candidate to have had a problem.
Okay, so we'll come back to you, but I want to get Derek involved in this now. So,
Really?
KlickEx is totally different to this.
Yeah.
Can you tell us a little bit about the background to KlickEx, how the idea came about, and what you've done to produce this very interesting product and service?
Well, to begin with, maybe what KlickEx is it's a banking and technology software. We built it for use, particularly in emerging markets. So it's the way we've taken the modern developed market banking systems and we've deployed it in third world. So we go straight from the central bank level right out to mobile phone banking. So we think it's a solution to poverty. Now that's because there's a lot of remittance flows going back to these third world countries, something like $300 or $400 billion a year, and there is just huge amount of fees coming out. So we've turned banking into an email level service in terms of the fees and charges.
So take me back just a little bit.
Okay.
What was the problem that the countries had and the people in the countries had?
Oh, it's the cost of, there's a lot of remittance workers, so people leave usually third world countries and come to developed countries and then send money home.
Right.
So as they're sending money home, it's difficult because there is no evolved banking system in the home country usually, so it's very cost inefficient to get money from a bank in the United States, for example, and send it to somewhere like Samoa, not to pick on any particular country.
Yep.
But so we went and said, well, actually, you know what, with mobile phones out there and with all these other technologies, why should sending money cost more than an email or a text message? So we took that premise and we re-engineered how the banks can talk to each other. We found ways in which to get around problems internally with internal processing systems, and we built an inclusive financial network that's deployable in the West, in developing markets, anywhere where there's cell phone coverage or internet access.
So hang on. So if I'm in a South Pacific island somewhere.
Exactly. Yeah, that's where we've begun.
Okay.
So we've just completed the testing down the South Pacific. So we've got a great partnership with a big cell phone carrier called Digicel, which is actually all throughout the Caribbean as well. But we've deployed in the Pacific, and our technology is now the dominant mobile international remittance system in the South Pacific through Digicel, our partner.
So I'm somebody in the United States, let's say, and I want to send some money to somebody on a South Pacific island somewhere. I send them an email.
Oh, there's many ways you can do it. Now, we don't operate in the US yet, but let's take the step that we've arrived in the US. We operate out of Australia, New Zealand, and the UK.
Okay.
But if you're in the US, you would easily log onto our system. You'd call up funds either through our system or you go to your own bank and pay it into an account. So we just verify that the money is available. And then there's many ways you can send it directly if they if the recipient in that remote country has a cell phone attached to this user, attached to Digicel, this company. You send the money straight away, and it will instantly be there.
And they don't need to have a bank account or anything?
No bank account. So this is solving a lot of problems.
Whoa.
There's a lot of interest in this, and we've solved a lot of problems that just nobody's been able to come to. There's a lot of alternative problems for domestic mobile systems, but we are almost the only people in the world that we know of that can do this international part as well as we do it. So it's a really big problem, and the banks can't do it as well. It's something, particularly for these micro payments. So we target really payments below $50, and we can get it there for about the cost of a postage stamp in real time, even on the weekends.
Wow.
So it's quite a leap from the service provisions. Now, there are other companies that can do it. They're big money transmission companies, but the fees and the infrastructure costs and the bricks and mortar branches that they have are quite prohibitive still. So there's a lot of initiative from non-government organisations and development agencies as well. All have been trying to do what we've been doing in secret in the South Pacific for quite a while.
Right. So how did you come across this as a problem?
Well, me personally, I was lucky enough to spend time as a kid growing up in the South Pacific, so that's why I talk a little funny. So I knew villages and remote islands who just had no access to the financial system.
Right.
Now, coming from the US and living some of the time in New Zealand, where we've got great banking systems, and you see that really the benefit of being able to send money backwards and forwards,
Sure.
or have an economic commerce system that's in real time and low cost. And you go to the islands, and often there is no e-commerce system. There's not even, you can't even write checks because you're so far out in the islands, you've got no access to effectively great banking infrastructure.
No, there's nothing there.
Yeah, there is nothing, literally nothing. So when you go out there and you see all of a sudden, even in the 90s, people they have no cash, no commerce, and hardly shops and things like this, but they've got cell phones.
Right.
So I've been to countries like Vanuatu, where there is no sign of civilization apart from the odd Coca-Cola bottle. And nothing else. And apart from these guys now have cell phones. And so the cost of putting out this infrastructure was profitable for a cell phone company. And what we've done is we've taken these cell phone networks and we financialized them, which is a really key step in getting these services, not just transaction services, mobile banking, but also saving products and everything like that, out so that people can put money aside. So if there's a hurricane in these really remote villages, they've actually got the resources to call up someone in the mainland and say, actually, I've got $50 saved. Can you send some stuff out to this island? But before, they may have had $50 worth of saved produce, but there was no way to get that within 3 to 4 days or a week into the mainland to pay for the services that they needed in an emergency. So what we're doing is really having huge benefit.
I was going to say, this sounds like it could substantially impact the economic culture out there.
Yeah, it certainly does. With the internet arriving as well, it means that these small island communities can do work for American or Japanese companies doing search engine optimization. But until we came along, there was really no way for them to be paid. If they did a day's worth of work, $50, $100, how do you get money to a village, an island 200 miles from the main centre in Fiji?
Wow.
All of a sudden you can do it now. So it's quite a big step. We're pretty proud of what we've done.
So you're one of the founders. How did you put together the team?
The team? That's a great story, actually. By chance, you meet great people by chance. So I met Brett, who's the technology guy, at actually my birthday party. He was a friend of a friend of a friend, and people at the party said, "You guys have to meet." So we went and sat down. He runs a whole lot of very good computer systems in New Zealand. So we were across there. We said, "Oh, this is the problem that I see in banking, and this is how I think it should be fixed." And he said, "This is the problem I've got actually, and I have a few businesses that have this problem, and I can't do settlements." And so we sat down and we pretty much planned out how we thought it should work, and thought about it for a fair while, and sat down. And then when it came time to make it real, Brett was friends with Ross, as the former CEO of Microsoft in New Zealand, and said it's time to put a dream team together. So we formalised it, and here we are.
And when was the team put together?
This came through the end of middle to end of 2009.
Right.
Because we then had to build the product and go through a lot of regulatory approval. If you can imagine being able to move money from the US, say we were operating here, to New Zealand, and then to Samoa, and then to Australia, and then back to Tonga. You can do that all inside about 5 minutes now. And if you can imagine the regulatory risk of where has my money gone, and the banks saying, sorry, you can take money out of a US bank and put it in Samoa in real time. We don't like that.
Yeah.
So we had to go through a lot of that. So we've had a lot of work with the central banks as well to get that. But so we had to get a team that was credible and had the requisite experience in order to convince that we were able to use this great system and put it to good use.
So as the founder, you brought in a credible CEO to help you with the organisation.
That's right, yeah.
Right,
that's right. It's a bit hard trying to say that you're going to change the way banking's done if you're 24 years old,
right?
As I was at the time. So.
Whereas Frank, your situation was somewhat different. You had an established team of nurses and doctors and people working on it, but they brought you in to bring the business side to it? Or?
Well, much of the team leaked out as the finances drained.
Okay.
And part of that was, in a turnaround situation, oftentimes you don't want some of those remnants. Some of the ways things were done in the past were some of the problems. So it's good to bring in a fresh team.
Okay.
And which is exactly what we did. We brought in fresh capital, fresh engineering team, and fresh professional management team to turn it around. I love Robert's point about friends who knew friends who knew friends. I mean the strength of the network can't be underemphasized.
Right.
And part of what a founder or CEO has to bring, I think, is a broad pool of resources that can be tapped into, both professional talent, the right accountants, the right attorneys who know the space, but also people with the expertise to build the company and the technical expertise to fill out the product.
Okay. Now, you've taken the route, you've both got regulatory bodies you have to deal with, so it means you've got lengthy times to do things. And building a medical device does take time and money. Did you raise money to do this, or was this raised by the team themselves? It's self-funded?
No, when we came in, they'd raised about $1.4 million. And in the about a little over a year and a half that my team's been in, we've raised a little over $2 million.
Okay.
More.
Right.
So we're about 3.5 million now.
Right. And what stage is the product and service in now?
Well, the stage we're ready to go to market, and that was only possible, a lot of our funding came from nurses, doctors, people who knew the space. And then as we got further down the pipeline, we were able to attract more angel money and super angel investors. And now that we're ready to go to market, the larger angel groups fit better. And so that we're hiring salespeople, professionals from IT and medical sales, the top, we call them big game hunters,
sure,
to come in and move the product throughout the country.
Okay. And what was your experience in raising venture capital in this current climate?
In this climate, it's a challenge. It's a challenge. But with a compelling story, a proven product, you can eke out some, use that to improve the product some, your experience used to improve the business model some. And sometimes people talk about pivot, but I think probably a constant iterative process better describes the growth of a young company. And each time you move to another level, you're able to raise a little bit more capital, which gets you to the next level and so on.
Okay. Now, so this is somewhat in contrast to KlickEx, which I understand has been self-funded.
Yeah, that's right.
And it's been, I mean, this is for...
It's kind of unheard of, particularly in our industry, right? So,
yeah,
we've done a really good job. So, Brett, luckily, Brett and Ross and myself, we had former careers. So I came out of banking and trading, and we developed this part-time as well.
Right.
And, in our spare times, weekends and nights, as most people do in their garages when they're sort of our age. So we haven't needed to go out, and we wanted to really get the product up and running and tested, because these are either a go or a no-go.
Right.
But they can take a lot of money and become a no-go, as quite a few of the businesses in the industry have. So we really wanted to test it and make sure it was absolutely rock solid and regulated before we went to investors. I mean, we're starting to have the investment conversations right now, and there's nothing more exciting than people coming to you and saying, we can give you the resources to take this worldwide, but there's a lot of responsibility. You don't ever want to take someone's money and say, we don't know what we're going to do with it. So as we kind of launch up and phase change, as we call it, it's a really interesting time.
So what stage are you in now? What stage is the acceptance of the product out in the market? Is it being but beta tested? Has it been rolled out? It's completely live. So it's the core platform is finished. It took us a long time, and in order to get into our market, you need to have. You can't lose $1. If you lose $1, then there's a potential to lose $1 billion. So that's a bit.
no money can go missing.
How do you do that? We just lost a little bit here. Don't worry about it.
That's right. Yeah. So because it's completely scalable. So the bigger you get, and if you grow explosively, then when you're dealing with money, it's very important you've got the security and risk infrastructure to mitigate any issue. So we've really tested that, and it's live. It works. It's very well regarded in its markets that it's in. We've had a United Nations Development Program through what they call the Pacific Financial Inclusion Project. We had extra grant funding from them as well. So we've not done this purely by ourselves. There's been a lot of support across the South Pacific to get this up and running.
Right.
And so now it's we've done it. We know that it works, and the Pacific is a really difficult market. It's got time zone issues. It's got some countries are on the other side of the date line, some are on this side, and they're talking to each other, and one's on Wednesday and one's on Tuesday. If you can imagine a trading system trying to settle trades in real time, that's not an easy thing to do. We actually managed the shift of Samoa from the Western Hemisphere back to the Eastern Hemisphere at the end of last year. We had no issue whatsoever. I can't say that about all the partners we were working with, and some that we relied on. But we're in a really good spot right now. So what we need to do is take what we've already done and just cookie cutter it elsewhere. So it's put people on the ground throughout Asia, throughout South America, Central Europe. It's kind of where we can go from here.
So what's going to be your biggest challenge in going from being testing it out and trying to make sure it all works to actually having a robust, production-ready, scalable system?
That's the exact question. It's finding the people to manage that as it grows. Okay. So we've gone from a team of there's really 3 to 6 of us that can manage the entire South Pacific region pretty well by ourselves. But we would need probably an equivalent team of that to manage the regulatory rollout process and get authorization to conduct financial services everywhere we go, which is a process we know about. We're really good at doing that, and we've got a lot of excitement from the central banks that we've approached so far to get up and running. But it's just we're trying to replicate an HSBC or a Citibank, which have 300,000 or 400,000 staff.
Right.
And we're trying to do it with about 50 staff. So
yeah.
it's, finding the right people is really key. So you've got to have great people to have an extraordinary growth path. So we're on the search for really good talent right now.
I'll bet you are. Yeah. No, that's right. So you've got to find some really quite exceptional people.
Yeah, well, it's fairly it's not too hard for us. People hear about what we're doing, particularly from banking circles, and they understand really what the problem is, and they see how it can help customers. And we've got a lot of enthusiastic people, even coming to us and offering to do jobs for free just to get us going, in order so that they can then be paid for it. Yeah, having the sort of vibrancy of a really young company and a new technology inside banking, which is quite an old industry, and very staid in its way sometimes, is really excites people. So it's a matter of making sure we've got the right people in the right places.
Great stuff. Frank, what's the next stages for you guys? You've raised a reasonable amount of money. You did a product launch at the middle of this year at Launch Silicon Valley. Everything's ready to roll out. What's the next step?
Well, we've got the FDA approvals in place. That's all done. That's an essential element. Now we're in the process of raising another, probably the last round of funding. Predominantly to expand production, but the majority of it go to be putting salespeople out there in the field and exposing the hospitals to the product and getting their final buy-in.
Okay.
We've got a dozen or so hospitals that have been involved in all of our beta testing: Stanford, UCSF, Kaiser, Loma Linda, Murrieta, VA, Shriners, UC Davis, that have all been involved to validate and help us tweak the product as we move along. So we're full production.
Okay. What do you anticipate will be? It's a very difficult question but when hospitals start to order, will they order 1 or 2 units, or what do you anticipate it's going to be?
Well, they can do limited numbers, but in many cases, because it's a risk mitigation platform, they implement it throughout all departments across the board, because then everybody sees that management is embracing this as a way of reducing their liability exposure, protecting the patients from accidental problems, and so it tends to be in larger numbers.
Okay.
A typical ratio is 1 per 10 beds.
Wow, so a large hospital could end up giving you an order for hundreds of units.
Well, typically we figure a hospital is an average of 200, 250 beds.
Okay.
So 20, 25 units is a common number.
Okay. And your production facilities are geared up to cope with that? So
we are. We contract that out. We use a nonprofit company, Pride Industries.
Oh, I know Pride,
and they do a phenomenal job of taking care of those details, actually receiving our components, doing the final assembly, packaging it up, testing, and then shipping to the customers for us.
Right.
We work with them. We have an individual who handles our quality control in parallel to their quality control, as well as all our FDA regulations. Having the FDA is both a good thing and can be a challenge, but it's a good thing because it creates high barriers to entry. That, in conjunction with our patents, prevent others from knocking off this phenomenon. We have 2 broad patents that have been in place for a number of years, and in April we're rolling out 5 more patents right now that are pending.
So you've got some protection there on somebody else coming into this market. They've got to do it a completely different way to the way that you've done it.
That's absolutely correct.
Right. Yeah. What about you, Derek? I mean, what would have stopped an HSBC coming and saying, okay, we're going to do this, we're the big boys in this banking field, we're going to take this all over from you. What have you got to stop somebody coming in and doing that?
I'll put it back to them. They've been trying for years and they haven't been able to do it. These guys have billion-dollar budgets every year trying to enhance their payment systems and things like that. We have patents pending as well, so we're quite covered in terms of specifically how we operate and how our systems run. in terms of a lot of the very technical stuff which sit behind the scenes, which consumers will never know. They just it explains these patents exactly how phenomenal services happen, but a customer will never actually see that patent in operation. But yeah, we're pretty well covered. We're in a good little spot, and it takes a lot of inertia to negotiate between 5 or 10 or 50 banks around the world and telco companies to all get these the way they integrate with each other in a real-time fashion. Different if they use the old protocols, which are all standardized. But in order to get the new ones running, it takes a lot of work, and you can imagine banking infrastructure getting together and having long meetings. We just do it.
That sounds very simple. I'm sure it's not as simple as that. We are starting to run out of time, so I'd like to ask you both a couple of questions just so we can wrap up on this. But what was the most difficult challenge that you faced when you were starting this out, and how did you overcome it?
For us, definitely trying to launch at the time the world was having a banking crisis. No bank understood what its banking systems were doing, let alone trying to implement a whole new one. So that was really tricky. So we had to step back again and say, well, how do we reapproach this market? How do we prove that we're not a bunch of fly-by-night kind of people? And it was really about credibility. These institutions we're working with have been around for 100 years, generating billions of dollars of profit from what they're doing, and trying to tell them that they can enhance customer service levels or save a few $100 million a day or a month in internal costs. They were like, well, we're hanging on to what we've got right now. So we had to step back and actually find little niche markets, which is where we found this mobile remittance companies and things like that. So it's really making sure that we went to the people where we thought the problem was the biggest, and where it actually is the biggest weren't the people that wanted to solve the problem the most. So we had to go and find the people that were really suffering in their own pockets, which was these migrant workers, and deploy effectively a retail solution, because this should have been an institutional solution that banks and big companies would use between themselves. We actually then afterwards, in hindsight, thought, let's give this to people.
So that was actually quite a pivot, that you went from institutional to retail.
Yeah. The product's still the same. It's exactly the same. All that we did was built a customer service interface on the website so that people could log on and see see where their money was inside the banking system at any time. So yeah, a bit of a change. We always thought that we'd have a pilot program which would have some couple of test customers and say, jump on this. We've just launched Euro, for example. Get on and see how it works. So you have to do that anyway, but we just opened up really that niche facility to consumers.
Frank, your response to that same question pretty quickly, because we've only got a minute to go.
Similar, we had to do a pivot to optimize the business model.
Right.
We found that, as we said, we had a lot of test sites, and we saw that there was a much larger market available, which was this risk mitigation. So we went from pure vein access to vein access with the risk mitigation component. Much larger market that the hospitals are much more responsive to.
So you both changed the business models and the approach that you have.
You've always got to keep evolving.
Yeah.
So you got to learn.
It was a radical change, and it's important that when we did that, we lost 2 of our managers. Okay. They couldn't go with the change and fell overboard. And the ship turned the corner.
Understood. Gentlemen, thank you both very much indeed. We've run out of time, unfortunately. A lot more I'd like to ask you, but thank you very much for coming along. So it's a good night from the Silicon Valley Entrepreneur. I look forward to seeing you again next month.